But the point is that that was a huge announcement, and it was 9 years ago last month. Now, since then, there is news of that importance coming out every couple of quarters now in ALS. So the part of it is resources that have been flowing into this disease and other neurodegenerative diseases, but but it really has accelerated the pace of discovery, and it's just a really exciting time to be involved.
Yeah, it sounds like it. So we should take a moment now and meet the rest of the panel that's going to be in and out tonight. Importantly, of course, is one of my favorites, only because I always mispronounce her name, is Dr. Hande Ozdinler. How did I do, Doctor?
You did excellent. It's a very tough name. It's a very tough name. It means the one who listens to the main points. But before I speak, I would like to tell you that Dr. Richard Silverman is actually with us tonight. And I don't think that if it wasn't for him and for our collaboration, we would be meeting, having this meeting or having this swim. And I highly appreciate his friendship, his collaboration. And actually, he's the one who brings people together, and he's the one who emphasizes the importance of collaboration, teamwork. And because of that, you know, he initiated the CLP, the Chemistry of Life Sciences and Processes Institute at Northwestern. So before I speak, I actually would like to give the floor to Dr. Silverman. Maybe he can tell us the importance about collaboration and importance about the CLP and the environment in CLP, and why this is so important for bringing people with different expertise and with different backgrounds, and how that actually changes the field. So maybe I can invite Dr. Silverman to say a couple of words.
So we'll do that, but just before we talk with Dr. I understand he's the inaugural Patrick G. Ryan, the Aon Professor of Chemistry at Northwestern.
That's right.
And really was the catalyst behind the CLP. Is that correct? Right. Yeah, wonderful. So Dr. Silverman, welcome. And we'd like to hear and learn a lot more about CLP.
Yes, thanks. So, yeah, I was one of the early people to discuss this, but Tom O'Halloran was really the brainchild of CLP. And he's really done remarkable for this. And he's actually the current head of CLP. Thanks for giving me that honor, but I'm sorry, I'm not. But the Chemistry of Life Processes Institute is housed in a building that was constructed to support collaboration. And it was among chemists, biologists, and engineers. And we're all focused at trying to understand and develop new therapeutics and diagnostics with the eye toward entrepreneurship, hopefully at some point. The spaces in CLP were designed to encourage interactions among all these researchers, and it's been quite successful. We have new companies that have been spawned, new therapeutics and diagnostics that have been advanced. We're now starting a brain initiatives platform, which Hande and myself are thinking of heading up. The first initiative of the brain initiatives will be upper motor neuron initiative in ALS. And so we're very excited about getting this going, and we hope to make great new advances in understanding ALS and treating ALS. So that's where our goals lie today.
You know, I've heard the word collaboration 15 times already in this first 15 minutes. Dr. Hande or Dr. Silverman or Doug, can you give us an understanding of why collaboration at this point is so important? Did we not see a lot of collaboration up to this point in ALS research?
Can I answer, Doug? Is it okay?
Of course.
So I think we have not seen it to this level and to this extent. And there are many reasons for it. Even for NIH, the way that the government supports a researcher is personal or single R01s, which means they are given to one person, okay? And that person has to convince the scientific community that that person is the best to answer that question, but it's individual effort. So even the grants were given for personal efforts, okay? But now we begin to realize that it is not possible for one person to find answers to complex diseases or complex problems. So there needs to be team efforts. And now there's co-PIs, center grants, and this idea of working together is actually becoming more accepted idea. But in the past, it was mainly who is the best. But now it's actually, can we do it together? And for teamwork, as Dr. Silverman has said, it is also important to bring people who have different expertise and different backgrounds and different upbringing so that they actually bring a different perspective. And if everyone is a molecular biologist, if everyone is a chemistry major, if everyone is a, one specific topic, then people may become blind. But if you bring people with different expertise, they will all add something different to the table. And then this would allow us to have a wider and also in-depth understanding of complex problems. And that's why the center ideas are emerging. Initially, for example, we would have departments of, let's say, just one topic. But now we're having centers where people with different expertise are united. And CLP is an excellent example for this. Because in CLP, for example, you don't only have chemistry majors, you don't only have biology, you have members from many different departments. The best of all departments come together, and their goal is actually to develop translational efforts so that the knowledge will be translated into solutions. And this collaboration comes in phases, right? First, the generation of knowledge, and then utilization of that knowledge into creating products. And I think that's why collaborations are important, because you need expertise at different levels.
Well, that is a very clear answer. Thank you so much. I understand also that Mukesh Gautam is with you tonight.
Yes.
And he is actually the recipient of one of the most generous grants right now from AlongSwim in funding the Ellen McConnell Blakeman ALS Research Fellowship. Can you tell us a little bit about that and what that fellowship will end up hopefully discovering?
So I'm going to introduce Mukesh. Maybe he can say a couple words, but we are thrilled to have the fellowship in our lab, and that's a blessing to us. And with this fellowship, we feel that Ellen is actually in our lab, and she's overlooking our activities and our efforts, and that's a blessing to us. And I think Mukesh was the best choice because he is also very collaborative, and he works with many people at Northwestern and also outside of Northwestern. And within the last year, Mukesh has made significant discoveries and contributions. So Mukesh, why don't you tell us what you have accomplished?
Yes, thank you very much. Yeah, and I thank everyone, and it's such a big honor for me to be the inaugural fellow from the AlongSwim. And what Doug and the AlongSwim does is just commendable. There are very, very few people who can even think of doing things like you guys are doing. And so recent, like one of the examples I would like to give of a research that we've recently done is that in the upper motor neurons, we have discovered that mitochondria are the first organelle which are defective in ALS. And we've used a variety of a mouse model to study this thing, and we discovered that the mitochondria are defective at very, very early stage. Even the mouse is not diseased, but when you look deep into the motor neuron by eye, use electron microscopy, which is a very powerful tool to look into the cells. And we found that these mitochondria were defective. More interestingly, that those defective mitochondria were not defective in a regular fashion, what other people have reported earlier. That usually when a mitochondria is defective, it is kind of killed or eaten by the other mechanisms. But we discovered that these mitochondria, especially in these ALS mouse models, were eating themselves, so that they were sick, but they were being cleared by themselves. And in the scientific literature, there is no term for such a phenomena. So we coined a term, we added it to the scientific discovery, and we called it mitoautophagy. This was one of the very important discoveries we made, and it was recognized internationally by many, many news outlets. And we were, on the basis of this work, we were invited to write a book chapter in a very important book in a Springer Nature publication. And basing our research on this discovery, we are doing more studies now to address if there is a way to fix those mitochondria or their functions so that we can work on some more drug-like molecules. This is just one of the research we have accomplished recently, but there are many more we are doing. And I wish all the best of luck to Doug for the swim. I can't even imagine doing this, but it's thrilling for me to be part of this adventure.
Thank you. Well, I think, I'm sorry, Doctor.
Yeah, adding to what Mukesh has said, we actually got a good news today. There is a NEALS ALS consortium, and they have yearly meetings. And we received the news that our poster was awarded Best Poster Award for the whole meeting. And it's actually our collaboration with a drug company which uses a small molecule to improve the health of mitochondria.
I'll be darned. Well, that's great. Congratulations on that. So, Doug, we're getting quite the backstory to the inspiration to your fundraising through all of this. It's a super worthy cause. You know, sometimes I tend to be a numbers guy. So where is Along Swim right now in the total funds raised since its inception?
Yeah, good question. We started to raise funds in early 2011. We had a warm-up swim that was the length of Tampa Bay in Florida that led to the English Channel and led to a number of other marathon swims. In addition to that, we host swims in the Chicago area, Lake Michigan, and other places that have been very successful, and also sponsor athletes, triathletes, and other swimmers as they swim remarkable different venues. To date, so call it 9 years, we have raised about $1 million between cash and non-cash contributions or in-kind contributions, and it's just been the most rewarding thing ever. Now, everybody remembers in 2014 dumping the ice water over our heads, and you know, which was a phenomenon that kind of came and went very quickly, but it just raised a carload of money globally, and so many of the exciting projects that the Osdendler Lab is working on, and now with CLP and others, are well funded and really moving along. I think the other thing, and we've learned from this pandemic, is that most of these problems really are solvable. It just takes resources. So it's you know, this is our opportunity to step up with those resources. I think it's also I mean, Mukesh was talking a little while ago. We call him, by the way, the Ellen Fellow. Only because it's all those other words that get kind of, you know, Ellen McConnell Blakeman, blah, blah, blah. But the Ellen Fellow, you know, the being on this team is a pretty good place to be. And the progress that Mukesh has made is pretty remarkable. So it's been very, very rewarding.
Yeah, that's great. And we have other members of the Along Swim team I know on with us tonight. One of them is your close friend and The other guy I say is the easiest guy in Barrington to work for, and that's Bob Lee. Bob, of course, and you were the inspiration for me getting involved in the very first tag days. I don't even know how long ago it was. It seems like forever. Bob, you have been a tireless fundraiser in your own way on behalf of ALS and always supporting Along Swim as well as the other organizations out there. Your, of course, a very similar accomplishment was cycling the perimeter of the United States, which is what, 11,000 miles? It has to be just as boring as swimming. I always sort of think the time you take off and the time you land for you and Doug were probably the highlights of the moment, although you got a chance to see more scenery. Tell us about your own inspiration for continuing to raise funds for ALS.
Well, Peter, thank you, and thank you for being the MC. And I'm not sure if everyone knows that Peter's not only a great MC, but he's a good bike rider.
That is a nice shirt.
In 2012, as I was riding down the West Coast, Peter came out and joined me and did some great PR work. He had the lights flashing on the Golden Gate Bridge. Welcome to Ride for 3 Reasons. So
that took a lot.
Peter is quite a marketer and a good cyclist, and we really appreciate all you're doing to help.
Well, that was a lot of fun, but I have to tell you, I walked my bike more than I rode my bike with him. It was just ridiculous. But anyway, I'm sorry to interrupt.
You got from point A to point B, and that's what counts. And that's where we hope we're going with ALS, is getting from point A to point B. And I got involved by reading a little book Tuesday with Maury, which I hope all of you would take the time to read if you haven't.
That's right.
Maury Schwartz passed away with ALS and told his life story, and it was very inspirational to me. But really what makes a difference and what keeps my heart pounding is really the people and getting connected with people with ALS. And I see Wendy Abrams is here tonight. She connected me with another swimmer, Andrew Fleeson. I was riding across the West Coast, the southern tier of the country, stopped in Scottsdale, Arizona to meet a friend of Wendy's. And Andrew Fleeson is English. He's a great collegiate swimmer who had ALS. He could stand up, but he couldn't put one foot in front of the other. And, just to see his enthusiasm, his drive to find a cure, to help other people with ALS was very inspirational to me. And just a little bit more about that swimmer. I met him in Washington for an advocate day. And we stayed up quite a while one evening, and I wheeled him in his wheelchair to his bed, helped him lift him up out of the wheelchair, get him into bed, pick his feet up, put him in, and pull the covers up, and left him realizing he couldn't scratch an itch, he couldn't change the covers, he couldn't get up to go to the bathroom. He just had to wait until someone came and helped him get up in the morning. So I think Doug and I would relate that we do what we do because we can, and we do it for people that can't. And there is way, way too many of those people that are suffering. And if there's any patients on call, we feel for you, we work for you, and we hope to find that cure quicker than later.
That's wonderful. Among the panel tonight, we have a couple other collegiate athletes in Ellen's sons, Brenton and Bennett Blakeman. And they are here. They are both board members now on the Along Swim team itself and directors of development. And you can see that they certainly have more than just the marketing to develop. They're really well fit swimmers. I know I've seen them do even the triathlons. So guys, what do you see coming up for Along Swim just in the the near future with the 13-mile swim that we're about to see on Sunday?
As part of the swim on Sunday, we're going to be both helping out along with Cliff Wilson and kayaking duties, helping lead Doug down Lake Michigan. But as you mentioned, yeah, we're also directors, trying to help, carry on the legacy of our mom, who obviously co-founded A Long Swim along with Doug, and the reason why the fellowship was named after her. But also, like you said, do some of the sponsorship athletes, which has been one of our newer fundraising initiatives in the last couple of years.
Yeah. So you may not have read, or maybe you did, yesterday, there were 7-foot waves on Lake Michigan. How's your kayaking skill, really? I know you guys cycle well and swim well and run, but something you're going to be able to handle? Or is that something you're going to leave to Cliff?
I've kayaked once this summer, so it's going to be a tough battle. I'm hoping it won't be as bad as the Pacific Ocean was, or the Atlantic Ocean was last summer. I can't say actually water, but Cliff can attest to how difficult and treacherous and cold that was, especially when there's jellyfish and always keeping an eye out for shark fins.
Yeah, if any of our viewers aren't familiar, Doug's swim last year was Martha's Vineyard to Nantucket to Martha's Vineyard, I'm sorry. And obviously the boys were out with their uncle, and Cliff probably had some of the best shots as he wore his fisherman's hat and all your rain gear. That was just a horrible, horrible day all the way around. So Cliff, are you going to be ready for what comes your way on Sunday?
Absolutely.
So positive.
The relative advantage of being in a kayak versus being in the water. I think one of the more remarkable aspects of this is when you're in a kayak, you have very little perspective over where things are going, because you're only 2 feet above the horizon line, the water. But until I'd gotten involved in this, it much occurred to me that the guy swimming has no perspective at all. Yeah, we're ready. We're ready to support Doug's efforts, and believe me, Doug's doing the main thing.
When Doug did the Molokai swim, and I think Don McDonald did a lot of the kayaking for that, I'm pretty sure I remember. I have the picture actually in back of me here at the store. Don McDonald actually ran over Doug with the kayak. And Susan was able to grab a wonderful picture of that.
Okay, well, collisions are part of the deal.
Heads up, Doug.
I would have, prior to having ever seen any one of these things or been around one, and my first was Catalina to California, I would have thought that with GPS and guide boats and all those kinds of things, that it would be a really efficient exercise, that you would see a swimmer, swimming on a very straight line over a 12-mile distance like is going to happen on Sunday. And it's not like that at all. It's very difficult to keep the boat on course. It's very difficult to keep the swimmer on course. So when, Doug describes 12 miles of swimming, I'd guess it at about 3 times that amount as he wanders between guide boat and kayak, and the whole operation tries to stay on line. It's fascinating. And I do enjoy it.
Yeah. Bennett, are you also a marathon swimmer?
Marathon swimmer? No.
Okay.
The longest I've done is 2 miles for a triathlon, but that's
okay.
I don't even like to get wet.
So I'm trying to recruit Doug to train me, and But the unfortunate day when he can't do this, maybe I'll be the one that takes the torch.
Brenton, what about you? Do you do any marathon length swimming or half marathon?
I can only
You guys
say
are both.
I haven't done anything more than triathlon distance.
Okay.
I would need the training from Uncle Doug as well.
All right. Well, let me ask you this question now on behalf of Doug. Can you paddle a kayak for 4 or 5 miles? We want to make sure before we put you out there.
Yeah, absolutely. Well, that's why we got recruited for the task.
Kate, this might be a great time. I don't think we had a chance to see the actual course.
Yeah, let me
Do you have
pull up the map.
Yeah, pull up that map. So, Cliff, to your point, it would be a very scenic boat ride, if you will, against the vista of Chicago and coming into Northwestern Hospital with the beautiful high rises, some of the best architecture in the world right in front. You may be able to see it, and Brenton and Bennett may be able to see it. But Doug, you have nothing but water in front of you, don't you?
That's right. It's the view kind of never changes for the swimmer, and I'm so glad that Kate put together this map. Of course, Chicago is one of the most beautiful cities in the world, and our plan is to start the swim at 7:30 on Sunday morning at Lighthouse Beach, which is immediately north of the Northwestern campus. There you go. And immediately north of the Northwestern campus in Evanston, and kind of a convenient place to kick off. So we'll swim the length of the campus, of course, and then it's kind of a long slog down the north shore of mostly Chicago as you get across from Evanston into the city. Montrose Point is the one that kind of bumps out there, and so on. We'll go by any number of harbor mouths and that sort of thing, but Montrose is really the only thing that kind of disrupts the straight line. Start to finish, it's 13 miles, and we're kind of budgeting 7 or 8 hours for it, depending on what the waves decide to do that day.
Well, it's always an amazing feat, half marathon or full marathon, and you've done full marathons plus. So, I know everyone here is wishing you best of luck, as everyone that couldn't join us tonight is as well. So I'd like to touch back on a few of the mile markers that we're finding right now in ALS, and one of them is in some new drugs that have been developed or funded. Dr. Hyundai, can you tell us a little bit about that? Just a few weeks ago, there was news of, is it Amylyx Pharma heading towards a phase 3 trial?
Yes.
For a new ALS drug, while
Exactly.
Another one that NeuroOwn, I guess, heads to FDA for approval in it. How does that impact your research on ALS?
In a very positive way, because these are exciting times for ALS drug discovery, and as Dr. Silverman would agree, and I think we have seen the light at the end of the tunnel. And previously we only had a couple genes, for example, found for ALS. Now there are 145. And we have, more than 45 clinical trials in phase 2 or phase 3 for ALS, and that's huge. And, recently my review for expanded access is accepted. It's in Feb's journal. And that is the importance of shifting focus from disease to mechanisms. And the Amylyx drug is actually a combination of 2 drugs. And those drugs were previously on the market, and they were known to improve the health of mitochondria and reduce ER stress. And those are 2 mechanisms that are important for motor neuron survival. So they mixed those 2 compounds and made it a cocktail compound and gave it to ALS patients, because they know that the underlying causes, one of the underlying causes, are actually ER stress and mitochondrial dysfunction. And they have seen improvement even in a very short time. It was significant. And, you know, that's why they passed the phase 2. So this is excellent. And the compounds that Dr. Silverman and I am working on, again, they improve the health of the mitochondria, they improve the health of the ER, and this is excellent because these are two very important mechanisms. And rather than focusing on curing the disease, I think now we should focus on, you know, overcoming the underlying cause. So once we understand why patients develop the disease, then it's not really just one disease, right? With the same compounds, with the same drug, you can treat ALS patients, HSP patients, PLS patients, Parkinson's patients, Alzheimer's disease patients. So because the disease is so heterogeneous among patient population, there will always be a subgroup which would benefit from the drug that you have. And I think FDA is also changing their perspective so that there won't be a drug for a disease, there will be a drug for a mechanism. And then the doctors will be able to prescribe drugs based on the underlying causes. And then we don't really need to have it, you know, one magical drug for one disease, but we will have drugs for multiple diseases. And then the rare disease patients or patients who are ignored or have never been included in any of the clinical trials will now have a chance to be cured. And to me, that is a huge progress. And that's why the MLX is great news for everyone, including us. And I think that gives us hope that the drugs that Dr. Silverman and I, or Dr. Silverman in collaboration with other people develops, will have a broader impact for many other diseases. Coming back to the neuron, so they say it's a stem cell therapy, but actually it is a growth factor therapy because they use stem cells as a tool to secrete growth factors. So they, for example, manipulate stem cells such that they will secrete IGF, BDNF, NGF, VEGF, CNTF. So those are the growth factors that motor neurons like. And so I see it as a growth factor therapy. And we know in the past that the growth factor therapy works for Parkinson's, for other neurodegenerative diseases. And as long as we know which growth factors motor neurons like, it's most likely that we will have cures because we will support their survival and health. So, you know, we are understanding the underlying mechanism. And as we understand the underlying mechanism, then there are drugs that are coming up. And as Doc was saying, this is the best time. This is the best time to support research. This is the best time to expedite research efforts because the faster we walk, the faster we run, and the faster, you know, we swim, we fly, I think the faster we are going to touch the finish line.
This is somewhat abstract, but sort of contemporary in what's going on in our world today. Is there a relationship to any of these medicines to COVID-19?
That I don't know. In what relationship are you asking?
Is there any benefit through the drugs being developed right now that could help with the virus?
That I don't know. If the compounds improve our immunity, our you know, our health, so that we become more immune, it may help. But other than that, I'm not sure because it's a different mechanism. It's an RNA virus, and I don't think it impacts motor neurons, and I don't think it is a neurodegenerative disease. So I'm not sure if the drugs that we have for ALS would also have an impact for COVID or for
okay.
ALS. I'm not sure.
All right. Well, I know that we have a lot of attendees that have questions, and Kate, why don't you read through your chat box and try to grab a couple that the panel could answer?
Yeah, so the first one wants to talk about the currents or the tides, and also where will you be finishing, Doug?
Okay, in a lake like Lake Michigan, there are big waves, depending on which way the wind is blowing, and but currents are very minor. They move in a clockwise direction, so we'll actually be swimming into whatever current is there. A much more relevant issue are the waves, and what we should all be hoping for is a light wind from the west or the south on Sunday. North or northeast is really going to be painful. In addition, the finish line. We talked about starting at Lighthouse Beach, just north of the Evanston campus in Northwestern, and we will finish as close to the medical school as we can. Think of Ohio Street Beach, just north of Navy Pier in Chicago. I'm told that that Ohio Street Beach is closed because of the pandemic, but we'll figure out how to see some well-wishers there. Unlike most marathon swims that require that the swimmers start and finish on dry land, again because of beach access restrictions, we'll be starting and finishing on a boat. A little bit less romantic than a beach landing, but effective nonetheless.
Doug, that kind of parlays into another question. Is there a way to celebrate towards the end and possibly help donate?
Yes, the donations and contributions are humbly accepted. One way is on our website, alongswim.org/donate. It is shameless in its obviousness on the website. And there's a mailing address at the bottom of the website as well for folks who want to who prefer to send in a check.
Yep, and I'll be throwing the link in the chat box ever so often, so feel free to follow that link as well. That'll take you to this specific swim's CrowdRise link, but don't worry, anything donated will go towards this swim at this time.
Kate, also, let me just interrupt here for just one moment. You know, I'm looking at this this next 60-day period as make a splash. And we don't want anyone to feel that the donations need to just be done at this particular point. We're gonna sort of actively market this and the highlights of the swim over the next 60-day period. Gives us plenty of time to raise some needed funding. And that always leads me to a question that I know it shouldn't be this time, but you know, I still use the phrase in the writing I do on Doug's behalf and Bob Lee's as we're going to see a cure in our lifetime. How likely is that, Dr. Silverman and Dr. Hyundai?
Is Dr. Silverman here, or maybe he left? Dr. Silverman is here? All right, so maybe I can answer that. I honestly and truly believe that we will see ALS survivors. And there are multiple reasons for my optimism. One of them is we understand the underlying causes much better than 5 years ago. So we know why motor neurons die. We did not know this as good as we did now before. So we know the mechanism. So that's very good. And we also realize that the disease is so complex. Okay, so this may be taken as a challenge and as a hurdle, but it is also an advantage because the disease is so complex. We begin to realize that one drug is not cure all ALS patients or all neurodegenerative patients. We will have to do a matchmaking, saying, okay, so you have this underlying cause. All right, so then this drug will be good for you. You have this underlying cause, okay, this drug will be good for you. So FDA already approved thousands of drugs, and we know that they are not toxic, that they have good efficacy, and that we know their target engagement, we know the mechanism they act upon. That's why we will see a huge wave of repurposing of drugs. And actually the second drug that was approved by MT Pharma was a stroke drug. It was actually used on stroke patients, and the goal of that drug was to reduce free radicals. And now it emerged as a second ALS drug. The company, the mitochondria company that we're working on, is actually has a compound for mitochondrial disease patients. And now we see that it's actually useful for diseased upper motor neurons. And I think within the next 5 years, we will see a huge increase in repurposing of drugs for a subset of patient populations. And then we will begin to understand why each disease or each patient is developing the disease. And now we actually submitted our first patent application. We have one more coming up. Us and other labs are beginning to understand why patients develop. Let's say if you have this protein in your blood, then you most likely develop the disease because your mitochondria is not working. If you have this protein in your blood, then maybe you have ER stress. If you have this protein, then maybe your axon transport is defective. And as long as you know what is the reason, then there are maybe 5, 6 different drugs for that reason. So then it's the job of the doctor and the physician to realize what is the underlying cause. And there will be personalized medicine approaches. For example, one patient is going to get drug ABC, the other patient is going to get drug BCD. All right, so then it will be a cocktail of different drugs for each patient, and patients will improve their condition because we will know why they have the disease, and we will have the drugs that would improve their underlying cause. And once we have this matchmaking, it will be like, you know, you have a nut, right? And then once you open the nut, boom, everything opens, right? So it will just resolve itself. And once we resolve ALS, it will also resolve HSP. It's also resolve PLS. It's also Huntington's, Parkinson's. And I think this decade will be the decade of neuroscience. This is our time. Because previously in the cancer fields, they focused on tissue. Let's say, for example, breast cancer, you know, prostate cancer, this cancer, that cancer. Then they realized it's not really the tissue. It is the mechanism. So then they called it melanomas, right? It's this melanoma, that melanoma, because they were focused on the mechanism. And once they focused on the mechanism, now there are cancer survivors because it's the mechanism that makes people sick. So now in ALS, in motor neuron diseases, we speak about mechanism. So once we, go deep into the mechanism, then there is cure. And I think we have come to that point. Now we talk about mechanism and we talk about drugs for that mechanism. And that's why I'm very optimistic, and that's why I look the way I look, because I'm so tired. I work like crazy. I don't even have time to put the makeup or anything, and I'm still in my office working. And it's because I really believe that there is a cure out there, and I'm doing, yeah.
And that, my friends, is why we swim.
Thank you so much.
Excellent.
I think we make a very good team. Thank you.
Yeah. Kate, do we have one more question?
Yeah, I think some people want to know a little bit from Doug on what your trainings have looked like, your feedings, kind of what happens when you're on the boat during the swim. Give us a little insight on that.
Yeah, a couple things. I had a weird injury this last winter, and so it was kind of a late spring to get started, and then they closed all the pools, which made it a little bit more difficult. But so I've been hard at it this summer. And I swim between 13 and 16 miles a week, which is a sort of an appropriate training load for a swim like this. It's all been in open water, a different lake every day, it feels like. I've spent a lot of time in Lake Michigan this summer, and conditions, of course, can be widely varied between waves and cold and a number of other things. The good news is I saw somebody popped up in the chat a while ago wondering if I would miss the jellyfish, and no, I will not miss the jellyfish. But the good news is that we don't have those in Lake Michigan. So the swim itself is really an exercise in boredom. Every 30 minutes we stop for feeding because you need to keep supplying those calories to sort of feed the engine. It's according to English Channel rules, you may not touch the boat, the escort boat, or anybody on the escort boat. So it's every 30 minutes. one of the habits that I've developed is that I count my strokes. And I know that that every 1,750 strokes is another feeding stop. And so I'm really not, psychologically, I'm not swimming to the finish line. I'm just swimming to the next feeding. So it's, and I know I can make 1,750 strokes anytime. So the other crazy thing that has happened just in the last few days with Lake Michigan is that it has gone through an inversion. And it's where all the cold water from way down deep has flipped over and is now at the surface. We did a training swim in Lake Michigan just a few days ago, and the water was about 70 degrees and very comfortable and so forth. 3 days later, it was 58. And 58-degree water is cold for anybody, and so we're hoping like crazy that inversion corrects itself. But that's we're sort of anticipating that may be what we're up against on Sunday. So it's we're as I said earlier, we're budgeting 7 or 8 hours for this swim, so it should put us down at Ohio Street Beach, sort of mid-afternoon, 2 to 3 in the afternoon. We're also thinking it'll be about 20,000 strokes. So it's I'll give you the exact number when we're done, but that should get us pretty close.
Hey, Peter, one last quick question before we wrap up. Let's talk about our fundraising goal and where we're at and what you want to do with this one.
Well, our fundraising goal is another $1 million, and that would be in 60 days, which would be great. But realistically, we'd like to ask everyone at a minimum, let's make it lucky 13. Don't drop off less than $13, and $1,300 would be certainly more suitable. We've always had a good luck reaching out to our community. They are bottomless in their generosity when it comes to ALS and all things connected with a long swim. And we're hoping that everyone is there for us. We're going to get our direct mail pieces out. We're going to have a nice little winter cap that we're going to have ready to go by next week for all of our donors, whether they do it by mail or whether they stop in. We always like to have a little something to give away. And I wish I had a couple already, because I think Brenton, Bennett, and Cliff are going to need some winter gear out there this Sunday coming up. So, of course, we can donate online on a long swim site. You can also mail in a check to the long swim address, as well as dropping it off here at the store or sending it here at the store as well. And of course, even if you want to call the store number, that's Phillips and Barrington, we'll be happy to process a card for you if you want to do it that way, and keep track of everyone that's donating, and get a nice little winter hat out for everybody for the months coming.
It's crazy that we're talking about winter caps already, but
yeah.
Doug, can you please tell us how we can watch on Sunday?
Yes, I was just looking through the number of people who are left, and so many of the folks who joined us this evening knew my sister Ellen very well, and they knew what an unbelievable sense of humor she had. And I remember after one of our swims, I think it was England, when she said, this marathon swimming, this is never, ever going to be a spectator sport. But she said that little tracker on the computer really helps. So what we do have a tracker on this swim as well. And if anybody has a pencil, starting again at 7:30 on Sunday morning, patch into https://track.rs/a-long-swim. And we'll put that on our Facebook page and our website also. But it's really fun to watch the little tracker. There's a little beacon that comes up every 10 minutes, I think, and you can watch the swimmer suffer, right, or you can suffer right along with the swimmer. Maybe that's the better way to put it. So we hope everybody can join us on Sunday. This has been a great blessing to have everybody together. We cannot thank you enough, obviously, for your ongoing support for this this little crusade we've developed.
Well, it's wonderful, and it's more than a little crusade, and accomplishing just leaps and bounds every swim you do, Doug. It's just amazing to me. And we're watching that tracker. It reminds me of your Hawaii swim. I'm sorry, your Martha's Vineyard swim last year, where it was almost impossible to figure out what you were doing. So Brenton and Cliff, you make sure he keeps on that course that Kate laid out on the map for this time, and not some paperclip that in its course action. So anyway, so I think that should just about wrap it up for tonight. Do we have any last remarks, Dr. Hande? Oh, I think she muted.
Yes. So, you know, I gaze through who are on the call, and I see many very good friends, and I am so humbled and happy to see everyone and the support that we get. This is incredible. I feel so humbled, and I feel so lucky to be supported by Doug and by my friends, by Bob Lee, by Vandy Abrams, by, you know, Hank Chupi, by Deb, and, you know, by Susan. I have so many friends here, and I hope that we will actually have a celebration when we really have the drug with Silverman and biomarkers, because I think, as Doug says, the cure is out there, and it is up to us to make it a reality for everyone. Until that day comes, we will work really very hard.
Very good.
Thank you,
Doug?
Hande. Looking forward to it.
Very good. And by the way, I was looking at the attendees count at the top throughout this. I think it topped almost 70. And that is a little bit bigger than we're supposed to have in a room, according to Governor Pritzker. We need to sort of bring this down to 10. So,
thanks,
good night,
Peter.
everyone.
Thanks for doing this.
I'd like everybody to know there will be pictures and videos on Facebook all day long.
I love pictures and videos. You know I love them.
Yes.
Especially when you take them.
Will we have a drone, you know, going over? We will,
as a matter of fact. Yes, we have a drone.
Wow.
Oh, I forgot about that. We do have a drone. Yeah, you guys watch all day long, drink coffee, and hang out with us.
Yes.
Cousin Stevie's going to be the drone king.
That's wonderful. And you know, Bob Lee, it occurred to me that I have seen on recreational lakes these bicycles for water. They have these big tires, and you pedal them, and it might give a little bit of a respite if you got on one of those bikes. And then, have you ever thought of that? I think he's muted.
I have to unmute myself. No, I thought you were, when you started talking about those bikes, Peter, that's you were going to do, record, you know, right there on site. You know,
No,
I had the pleasure of riding around Manhattan following.
I remember that.
I was on a bike, so this is your time to ride on one of those water bikes.
Yeah. Well, maybe you and I should just get on the shore, and we'll just ride the shoreline. That's an easy ride. Well, thank you everyone for coming, seeing us tonight, and please, if you want to get started on some donations, let's do it right now.
Hey, this was well done. Thanks very much.
Thanks, Peter. Thanks, everybody.
Thank you, Doug. Thank you, Kate. Thank you, Susan. Thank you, Bob.
See you Sunday.
Sunday.
Yep.
Yay.
Nice job.